The event today is our first event we've had out in the east. There were still pockets of unvaccinated Tongans in this area. We decided to do some events before the end of this year to provide better access for people who are wanting an ethnic specific approach.
Being over a year now of being doing this vaccination event, we can see how the numbers of our vaccination, different areas of increasing the numbers, in some areas a bit quieter, and we can see the logic of how we're setting our vaccination is very efficient and effective in engaging with our community.
Some of the successes of why Tongans have had good uptake, particularly our registered clients, is because they are wanting an ethnic specific service provider to afford those public health measures.
As the practice nurse at the Panmuralangimali Clinic, I can see a real difference in patient awareness and vaccination rates compared to the rates at the beginning of the campaign. Patients are now asking if they are due for their boosters. Previously, we are the ones asking them if they would like to be vaccinated.
The Society is always planned to continue doing events right up to the end of December 22 because we took account of the epidemiology of the virus and that we predicted that there may be interval periods after infection and there may also be mini surges as well. The other thing was that we knew as time went by that this would be an opportunistic moment to actually add adjuncts into the COVID campaign.
Staying at the clinic or at the GB is very different when you go out in the community. So I'm thinking mobile clinic is one of the service will be need to roll on by the government so we can engage in the community with our people there. Any vaccination program we run in New Zealand at the moment, we can do it through mobile clinic. And not only that, if we visit a house, for example, we see the reality. If they need some housing support, we can go back and let the appropriate people follow that up. And that's the way we wrap around together what's the need of our population, especially our Pacific people.
I think food vouchers for the people who come to these events is a great service for our community. These vouchers make essential items like food and petrol more accessible when people are struggling to cope with the rising costs. Even though the infection rates are declining, I recommend people continue to get their vaccinations up to date, including their children. One of the key factors that is influencing the decline in infection rates is the high vaccination rate. It's pretty logical, really.